This is a breakdown of the Jameson Williams Detroit Lions wide receiver hamstring injury that he's dealing with. My name is Dr. Eric Broadworth. I am a doctor of physical therapy. I'm an orthopedic clinical specialist, a certified strength and conditioning specialist, and I'm certified in dry needling. I work primarily with athletes ranging from high school to collegiate to elite professional athletes in the Grand Rapids, Michigan area. And I wanted to go over Jameson Williams' injury and what he should be doing for rehab based on what I've observed just so far, and figured this could also help those of you who are dealing with nagging hamstring injuries. They can be a pain to deal with. So Jameson Williams, he tore he had a grade 2 tear or strain of his right hamstring while he was running a deep route in practice. That was on August 16th, 2023. So a grade 2 tear, that's a partial tear of one or more of the hamstring muscles. And we're going to look at that right now. So I'm going to share my screen with you. And we're going to share you this. So this is a model of the hamstring. Here you can see this is the left hamstring. So the hamstring is made up of several muscles here. So we've got our biceps femoris, which is on the outside of the leg. Okay, so here's the leg and the thigh. Okay, our quads are in the front. We've got our hamstrings here in the back. Here is the biceps femoris, and that's broken down into a long and short head. And then we've also got the semitendinosus and semimembranosus muscles, which are on the inside towards kind of the groin muscles. So they attach up here, okay, up at your butt at the what we call the ischial tuberosity, and they attach then below the knee. So what the hamstring does is it helps to bend the knee or flex the knee. It's also going to help with hip extension. Those are the primary movements and actions of the hamstring muscles. Now, it is not uncommon with these type of injuries. How he tore it sounds pretty classic. So it's typically people sprinting, they're overstriding, and then you'll see them grab their hamstring, grab behind their thigh. Pretty classic hamstring strain or tear. Now, with a grade 2 tear, you may have some bruising and some swelling, and typically you're out 6 to 8 weeks. Now, hamstring injuries can be pretty nasty to rehab sometimes. So most times grade 2, you can rehab conservatively. You're not going to need surgery or anything like that. It also depends on where the tear is. So was the tear in the tendon or the muscle belly or where it attaches the bone? And you also need to take into consideration too, with any type of injuries that people are dealing with, we want to look at what their injury history is. So he had that left ACL tear January 10th, 2022 in the college national championship game. And he came back from that fairly quick. He was back in the NFL season for his rookie season. He missed a little bit, but was back. So that was the opposite side. That was the left side. He had the ACL tear and reconstruction. He used a patellar tendon graft. So one thing I was curious with him was, did they use a hamstring graft for that ACL? And also, which side was it on? So it is on the opposite side, but anytime you have an injury, and part of me wonders, like, is that playing a role in this right hamstring strain? How symmetrical is he? How much is he able to use that left leg to be explosive, or is he still compensating with that right side? And did that lead then to this injury? So if you are dealing with a hamstring injury or any type of muscle strain, tear, the old model was PRICE, right? It was pressure, rest, ice, compression, and elevation. That's what they told you to do. We really want to get away from that, and we want to get more into the new acronym that they like to use, is called PEACE and LOVE. So PEACE and LOVE stands for protection. That's the P. That's going to mean avoid any excessive and irritating movement. So when it comes to a hamstring strain, right, we don't want to go and then sprint right after. That's going to tick off that hamstring. And we want to we want to protect it so that way it can heal. Okay, so avoiding especially movements that are very irritating. I like to use what we call the 2 pain point rule. So if you can do movements, but it needs to be less than 2 pain points. So if you're, say, at a 1, I don't want you more than a 3. I'm okay with it going up to a 3 as long as when you're done, it comes right back down. And after you're done doing that movement, that exercise, that activity, it doesn't stay elevated, right? It comes right back down. If you find that maybe you have a delayed inflammation response and you've got more pain after, then you overdid it. Okay. So you really want to keep that pain level low to allow it to heal and decrease the inflammation. Elevation. So get that limb up, getting the hamstring, that thigh up, laying down when you're resting. Avoiding anti-inflammatory. So went the P, we went the E. Now the A is avoiding anti-inflammatories. That includes like ibuprofen and ice. And the reason you want to avoid ibuprofen and ice is it can delay sometimes, or what the research is showing, it can delay the healing response. So it can actually make it longer to heal. Now, if you're in a ton of pain and it's really nagging you and ice feels good, is it going to kill you to do ice? No, go ahead and ice. Go ahead and use ibuprofen if you're in a bunch of pain. That's, my opinion there as far as avoiding anti-inflammatories. But if you don't need to take it, don't take it. Compression, so things like a Normatec or vasopneumatic compression, that can be great for reducing the swelling, okay, and helping to promote healing. And then education. So educating the patient on these things, on what they should be doing to get back to healing. Education is a huge part of it on what I use with my patients. Now the love part, the L stands for load. You want to load the tissues. You want to let pain guide you though. So doing things like bridges or things that are going to place a little bit of strain on that hamstring and make that hamstring activate, that's fine, as long as then the pain is, again, within that 2 pain point rule. Optimism. So being optimistic about it, doing affirmations, meditation, being positive, and like working on our mindset can make a significant impact. If we have a high drive and a good mental attitude about it, good emotional health, that's only going to help improve your outcomes. Okay. So really focusing on getting sleep, that's going to help with mood, right? Sleep is huge. You need to be doing that. Do affirmations in the morning, journal, things like that. And that can help with that optimism. Vascularization. So things like pain-free cardio. One thing that I love for vascularization and improving that is, as far as healing, is red light therapy. Red light therapy can actually help with nitric oxide production, which is going to help with that vasodilation and therefore vascularization. Red light therapy has been a game changer. The UFC is using it. A lot of these elite level athletes are using it. We use it in my clinic all the time, and it's wild to see. It will take the bruising and the swelling and decrease it right away pretty significantly. So I would be recommending that for sure. So I'm hoping Jameson Williams is doing that. Exercise. So, and that's a gradual progression of exercise. We need to start out low load. Okay. We need to start out making sure range of motion is good. That's first and foremost. Make sure he gets his flexibility back. It's all pain-free. And then we're loading the tissues. Starting out simple things like glute bridges, to then maybe some hamstring curls, then to some single leg RDLs and closed kinetic chain, hip hinging, deadlifts, things like that, where you're going to load that posterior chain is super important. And really with those exercise too, we need to be correcting movement patterns. We need to figure out, why did he have this hamstring injury in the first place? Is it because of that ACL tear that he had in the past? Did he not fully recover from that and he was compensating for it, and that's how he tore it? Possibly. Is it lifestyle factor? So was he maybe not getting enough rest? He was pushing his body too much. That's going to lead to increased risk of injury. So we know that sleeping for less than 7 hours a night puts you at significant risk of injury, especially for athletes. So making sure you're getting 7 hours or more of sleep at night, and then making sure training volume is appropriate. So anytime, especially with athletes, and you're training and you're pushing your body, your training volume is super important, and that needs to be looked at. Okay. But then again, also making sure that the movement patterns that you're using are appropriate and you're not compensating. If you go back to other elite athletes like RG3, if you look at his combine, now RG3 had knee issues, suffered several significant knee injuries, and ended up having to retire early because of that. You look at his combine and how he moved and how he was jumping, it was a ticking time bomb. You could see he valgused in, he had poor movement patterns. Usually that will lead to also a performance issue. So if you correct those, a lot of times you're going to perform better. So you're going to have a decreased risk of injury if you're moving well, and you're also going to have an improvement in performance. So this is always super important to correct those things. So when it comes to Jameson Williams injury and anyone dealing with a hamstring injury, go through that peace and love that we just went over. You need to allow yourself time to heal. So no pain, no gain is not going to help you come back. So coming back early and trying to push through it, you're just going to tick it off, make it worse, and likely, you could put yourself at risk for surgery. He doesn't have access to his team's facilities right now because he is on that suspension. So they're wondering, how is he going to rehab this? I'm hoping he's working with other good physical therapists in the area or physicians or something like that are outside the team's networks. But yeah, between those things and then the red light therapy, I'd be recommending, that's always good for any type of muscle and tendon strain and muscle recovery. Red light therapy is huge. Some other things that I'd be curious if he's looked into are PRP, which stands for platelet rich plasma injections. So PRP injections have become pretty popular to help with any nagging injuries and help that heal conservatively. However, with those PRP injections, a lot of times you're going to have to be off of it. So that might not be a route that he wants to do if he wants to get back super quick. That would definitely be up to a physician to determine. But if you're dealing with a nagging hamstring injury, I've worked with athletes who have used the PRP injections and they've gotten good success with those. So that's another thing to look into. But yeah, I'm a Lions fan. I'm hoping Jameson Williams is able to recover from this. I'm curious as to what his rehab and what he's doing for this, especially without his access to the team docs and facilities and things like that. So if you're dealing with a hamstring injury, I'm curious as to how you're handling it. Feel free to, comment in the comments below, shoot me a message if you have any questions, or email. I hope you found this helpful, and thanks for watching.